The benefits of a patient choosing private delivery are several. Probably the main one is continuity of care. What you get is you get the same person, monitoring the pregnancy throughout. And I think from my experience with patients like that continuity in the sense that they will see the same person all the time and in some ways establish a relationship with that patient. And what I feel is you're actually going through a journey with them, especially when they get pregnant, where you tend to get to know some of the patients, you know them before they get pregnant, if they've had fertility treatment with me and the journey is, at the end of it, it's quite fulfilling one, certainly from my point of view, and the patients enjoy that continuity of care. I mean, if truth be said, most pregnancies end up, are normal pregnancies. 90% of pregnancies are normal, whatever you do, or whoever looks after them. And there is a small proportion of women with complicated medical factors who will need more, more focused care. And consultant-led care, has got its advantages in the sense that women with specific problems are dealt with by somebody who's got expertise in dealing with high-risk pregnancies. The benefits of private delivery, if you are scheduled to have a caesarean section, I would say that there's probably patients have a slightly bit more choice in terms of the timing of delivery, although generally it's always after 39 weeks. We tend to avoid delivery before 39 weeks because of risks for development in terms of the baby's lungs. But I would say generally they have slightly more options in terms of choosing their delivery date. The other advantage is the convenience in terms of planning of your antenatal checks, and I think there is a bit more flexibility in terms of discussion with the doctor and the patient and the pregnant woman when they can have their antenatal checks. And in terms of access, obviously you will have access to one person who knows your pregnancy very well. And as I said, but I'll stress again, I think most pregnancies are normal, and ultimately it doesn't really matter who looks after you. But it's the perception that you are being looked after by one specific person. And if anything goes wrong, I suppose I've been a consultant for the last 14 years. You have the benefits of that experience, which is difficult to put into value. But if there's anything which goes wrong, you have that reassurance, that security, insurance policy that you have somebody with a lot of expertise in dealing with pregnancies that can go wrong.